Next is this, also the same holds true with regards to 2 months and 3 months post immunization. You can see a significant increase in the need for 2 doses. So the adjuvant really significantly increases the amount of efficacy and antibody level that is sustained, that it lasts for a long time. Right. Immune response to AS01B in humans. So this is, again, just tells you about age-related. So you can see as you increase the amount of, and it talks about the adjuvant there in the red bars, and for ages, this is just another way to say, with the older patients, you need an adjuvant to help the vaccine last longer. And that's really what this important curve. So immune response in adults over 50 years of age were generally higher in people who had the adjuvant. Okay, so here it is. So we've got the protein, we've got the adjuvant over there, the vaccine. So we've got a recombinant subunit vaccine. And it helps to overcome the decrease of your immune response with aging. So back to the vaccine and its safety, efficacy and safety. So we heard about how the studies were done in various countries around the world, and I was honored to be part of one of the Canadian sites. Next, so let's talk about the studies of the vaccine. We talk about has thoroughly investigated 2 large pivotal studies. There's one called the Zoe 50, Zoe 70. Zoe simply means zoster with regards to 50 years of age and older, and the zoster 70 years of age and older. And you can see we gave them two doses. You can see the number of patients we had to enroll around the world. Almost 16,000, 15,000. A lot of patients were enrolled. And in this study, you had 3 patients. 1 would get the vaccine, 2 would get the placebo, but it was double-blinded, so we didn't know. So here we can see the results. The results were quite impressive, and this is the good news, is you can see that for the Zoe 50, the Zoe 50-70, its efficacy was phenomenal in terms of 97% after 3.5 years. So this was very encouraging, and we managed to publish these results. And you can also see that its efficacy on the right side in terms of after 4 years, in terms of 50, 70, and as well. So what about the herpes zoster complications among groups of 50 and 70-year-olds? We really sort of see this, that post-herpetic neuralgia was significantly decreased as well. What about long-term follow-up? So you heard that just Zoe was only 3.5 years. What about longer? How long does it really last? And that's a common question you're going to get. Do I need to revaccinate? If so, when? Or if ever? So with that, we created not only the Zoe 50-70, but we extended it. All those patients we followed for 4 years, we knocked on their doors or rang them up, say, can we follow you for another 6 years? And they said yes, and so we extended another 6 years. So we got actually 7 years, 11 years data so far, and we are still following those people. It's now 13 years into it, and so we have found the efficacy primary endpoint looked at very impressive, that up to 87% efficacy against shingles after 11 years, okay? So it lasts at least 11 years. We're following them again upwards to 15 years. So I'd be happy to come back and talk to you again when we have 12, 13, 15 years data. So this is very reassuring. So this is based on the technology of the adjuvant stimulating the immune system. So this is very helpful. So again, what about post-herpetic neuralgia in that group? I squared it off over there. There's the efficacy for post-herpetic neuralgia. If you're unlikely to get a small portion, still got shingles, if you did, your probability of reduction of pain was significant. So either it prevented it, and if you were a small portion who got it, you had a significant rate of reduction of post-herpetic neuralgia. So what's the next question people will ask you? You've now recommended it, this vaccine. They're going to always ask you, what about its safety? And so you all know this, so just review this with you, that 85% of people talk about a sore arm, right? That arm is sore that night and especially the next day. And so the nurses who did the clinical trial with me said it was like a light switch. Within 48 hours, the pain was gone. The symptoms were gone. So what are the symptoms? I always tell everybody, 85%, you're going to get it. You're likely going to get this. I recommended this vaccine for my parents, and they bragged to me a week later, said, we got the vaccine, but we didn't get any symptoms. Was that bad? No, you're good. So you can see that the degree of discomfort, redness, and of course in the very massive swelling. What are the other symptoms they'll generally notice is flu-like symptoms, myalgias, fatigue. So that's around 50%. We'll get that. So I warn all patients, take paracetamol that night, next day, or the day after. And so patients will, if you warn them, you tell them, you're going to get this. It's not going to be that bad, but you can control the symptoms. That way they will be reassured, so when they come back to receive that second dose. So what about the overall incidence of adverse events, severe adverse events? And so you can see this vaccine was no different than the placebo, and we followed these patients, and we're still following them for severe events. So we're up to 11 years, and we're looking for any other additional adverse events. So finally, safety. There were 5 cases where herpes zoster-related complications in people who received the vaccine. These are the 5 patients. You can see all of them were well in their 80s. Do you think this is related to the vaccine? No, we don't. We think it's just these were older patients, usually at around the 7 to 9 year point where they developed these complications of the shingles itself. So, finally, storage and administration. Yes, keep it in your fridge, or if you do have it, the pharmacies will carry it. Keep it in the fridge. You do not freeze it. It's just 4 to 8 degrees. It's 2 vials. You put the liquid into the powder, you swirl it around, draw it up, and you administer it, and it's given IM, and it's really very simple injection. You do need 2 doses. And so this vaccine is definitely indicated for prevention of herpes zoster and post-herpetic neuralgia for people who are 50 years of age and older, or 18 years of age and older who are immunocompromised. So if you're 50 years of age, I'm going to just ask you, have you had this vaccine yet? And I know that I had it, and I managed to talk my wife into getting it. So this is just to reiterate, once again, you do need 2 doses. If you get only 1 dose, you get a very blunted response. Second dose, it primes the immune system, and you get this significant increase. So that's very important. So in Saudi Arabia here, there's the Ministry of Health recommends 2 doses, 2 to 6 months apart, at all people who are over age 50. So you may ask, what happens if someone forgets to come back for that second dose, and it's now been a year or 2 years later? You do not need to start all over. You just pick up where you left off. And that's the case with all multi-dose vaccines, like the hepatitis A, Hep B vaccines, or some of the other multi-dose vaccines, even the HPV vaccine. You just pick up where you left off if people have forgotten to come back for it. Can you co-administer this vaccine with other vaccines? Absolutely. Give the same day, the day before, the day after, it doesn't matter, whether it be influenza pneumococcal or the diphtheria Tdap. And we heard all about the importance of Tdap with pertussis. Great slides. I'd love to see them in my inbox. So co-administration is safe, there's no concerns, and it does not suppress your immune response. So that's very important. So last but not least, this is what I call the take-home slide. So if you want to take your camera, take a picture of this, that's great. So I use this regularly. These are the 5 key factors I tell patients and healthcare workers. 1 in 3 patients will get shingles in their lifetime. 2, probably increases over age 50. And if you're over 18 immunocompromised, absolutely. Number 3, this vaccine is an IM, 2 doses, 2 to 6 months apart. Efficacy at 11-year point is around 87%. The recombinant zoster vaccine is safe. Yes, it gives you a sore arm, and yes, it'll give you flu-like symptoms. And finally, it's so important for us as healthcare workers to recommend it. It's publicly funded here, but it's very important to recommend it. Great article I read from Australia, where it's also publicly funded, and they looked at why isn't this vaccine being used, because it's totally free. The number one reason why they found it was healthcare workers were not working on recommending it. So this is so important that patients really look for you to recommend it. And this is, we're going to hear a little bit later about how to do that. So it's okay and fine for Wayne to talk about this, but how do I actually make it happen, right? And I have patients every day. I see in my office, in addition to in the hospital. So in my office, I go, oh, I forgot to talk to the patient. So yes, write a note. Next time they come, mention it at the very beginning. So scan for knowledge, check your questions. Do we have Slido for this as well? Or probably not. Here we go. You don't have to do this. The recombinant zoster vaccine is indicated to be given for 50 plus subjects as a 2-dose series administered. Can you do it 1 to 2 months, 2 to 6 months, or 8 to 12 months? What do you think? We all know that, right? It's 2 to 6. Great. What vaccines have been studied to be co-administered with this vaccine? Is it the influenza? Is it the pneumococcal vaccine? Is it the tetanus, diphtheria, and acellular pertussis? Or is it all the above? What were these questions in medical school, right? You know, in nursing school, you sort of, yeah, good. So this is a pretty easy one. It's all the above. So the recombinant zoster vaccine is a 2-dose vaccine, with the second dose being given. Is it essential to be given? Is it a booster dose? In other words, you don't really, you're just boosting it? Or is it just, you know, we're going to complementary? What is the right answer here? Right? It's essential. You have to give 2 doses. So anyway, there we go. And one last question. Yes, you're getting that. Yes, absolutely. I didn't know I was having the Slido. I guess I do now. All right. Okay, what vaccines have been studied to be co-administered? So let's pick this one. Okay, we talked about essential. Yes, we can skip that one. And then we can go to the indicated which age group. That's it. Perfect. So I don't know if you managed to get that through Slido, but the RZV vaccine is indicated to prevent this infection and its complications in which of the following population? Would it be adults over 50 with chronic conditions, over age 50 without previous herpes zoster infection, people 50 years of age and older with previous episodes, people 18 years of age and older in immunocompromised conditions, Or is it all the above? All right. Things are moving, things are moving. Is that it? Okay, great. So yes, it's all the above. So Shakran, any questions? I'd be happy to take any questions, or maybe we're going to have a little break shortly. Okay, we're going to have a Q&A session, and thank you very much. It's my pleasure to present to you. And you know what? It's always easy to finish early because nobody is angry about finishing a teaching session early. Thank you. Shukran. Yes.
So thank you for this nice lecture. I think it was again a learning journey. We heard from Wayne about this vaccine, which is safe vaccine, like any other vaccine, which is highly effective vaccine, and it can stay with this effectiveness up to 11 years. I hope, inshallah, we can meet here after 4 years or 9 years, and we can say still it is effective after 15 and 20 years. So again, thank you, Dr. Ween. And I am with your point that you mentioned that the healthcare practitioner should recommend this vaccine to their beneficiary, to their patient, especially those above 50 and those who are immunocompromised. Some of the healthcare practitioners will say we have difficulties to have the acceptance of this vaccine from some of our patients. So how we could counsel them, how we could tell them that this vaccine is important. I think now the time is for Dr. Solafa to talk about closing the gap, how we could counsel our patient, how we could overcome the hesitancy or resistance from some of our patients. So Ms. Solafa, she is a public health specialist, nurse, and infection prevention and control. She's working in King Abdulaziz City in Riyadh. She has a Master of Science Nursing Education. In College, Buffalo, New York. She has a Bachelor of Science Nursing at King Abdulaziz University, Jeddah. Sure, inshallah, you will enjoy her lecture here of how we could overcome this challenge with our patients. So, Ms. Solafa, you are most welcome to start your talk.
Thank you, Doctor, for this introduction. Good afternoon, ladies and gentlemen. I'm excited to have the opportunity today to discuss with you a topic that is both a challenge and opportunity in our practice, which is effective patient counseling. So for what I promise, it will be a highly interactive session, so your engagement is a key, although I fully respect if you prefer to observe quietly. So let's dive right in with an anecdote that beautifully illustrates the power of phrasing and perspective in communication. Probably some of you have heard this anecdote or this story before, but let's say it again. There was a king who had a dream that all of his teeth were broken. So he called one of the dream interpreter, and he told him the dream. The dream interpreter said, "Are you sure you had this dream?" He said, "Yes." He said, "Oh, the meaning of this dream that all of your family will die before you." The king gets mad and asked him, "Are you sure?" He said, "Yes." And he imprisoned the guy and called for another dream interpreter. The second dream interpreter came and the king told him the dream. The second dream interpreter told him the same response. "All of your family will die before you." And then he imprisoned the guy as well and called for another dream interpreter. But this one was clever. The third one came, the king told him the dream. So the dream interpreter said, "Are you sure you had this dream? Congratulations, O king, congratulations." The king surprisingly said, Why? He joyfully said, the interpretation of this dream that you will live longer than all of your family. The king said, are you sure? He said, yes. The king was happy and pleased, and he gave him a present. So, all of your family will die before you versus you will live longer than all of your relatives. How are they different? Isn't it fascinating how the same message wrapped in different words can lead to a dramatically different response? So our words have the power to imprison or to empower. This story is not about a king and his bad dream. This story is a master class of the art of communication. It teaches us that the effectiveness of our message doesn't rely only on what we say, but how we say it. And for us as a healthcare professional, our challenge is to navigate conversations with empathy, clarity, and tact, ensuring that we are not just heard, but understood and trusted. So as we proceed today, let's focus on refining our communication in approach and communicate effectively, and fostering an environment where hesitancy is met with understanding and information is delivered in a manner that is both respectful and receptive. So our agenda is simple for today. We'll start with the dynamic nature of hesitancy. Then we'll discuss a little bit of the effective communication strategies. And at the end, we'll go through structures that will help us deliver a message in a persuasive way and make it clear and memorable for us so we don't forget important elements in our message. Let's start with some definitions here. What is hesitancy? Can anyone here in the room tell us what is vaccine hesitancy? Let's define hesitancy together. So do you think it's only about vaccine uptake? So if I did not take the vaccine, am I hesitant? Just by not taking the vaccine? Okay, let's make it simple. Let's do it another way. If I am not aware of the vaccine or the disease that is causing the vaccine, I'm not aware of the herpes zoster as a disease, and I'm not aware that the vaccine exists, so I didn't take the vaccine. Am I hesitant? But I don't know about the vaccine. How am I going to take a vaccine that I'm not aware of? So I'm not aware of the vaccine nor the disease, so I didn't take the vaccine. Would you consider me as a hesitant? Huh? No, right? Because how am I going to do something I'm not aware of? So being not aware doesn't mean that I am hesitant. I'm just not aware. Okay, let's say I am aware of the vaccine and the disease causing, I am aware of the disease and the vaccine preventing from the disease, but I don't know why it's important for me to take it. There is a herpes zoster disease, so what? If I don't know the significance of the disease, I don't know the burden, I don't know if I am susceptible or not, so I didn't take the vaccine. Am I hesitant at this point? No. صح? If I don't know why, so I didn't take it, I'm not a hesitant at this point. I'm just don't have the necessary information for me to take it. Okay, so I know what and I know why, but I don't know where to go and take the vaccine. Am I hesitant? I don't know where to go and take it. طيب, I know that there is an important vaccine that I should take it, and I am okay with this, and I know why, but I don't know where and how am I going to take it. So I didn't. Am I hesitant? No. because I don't know where and how. So now, can we define hesitancy? So now we agree that unless I am, as a patient, have the answer for the WH questions, I am not considered as a hesitant. And let's say I have the answer, but the vaccine is not available, so I didn't take it. Am I hesitant? Come on, no, right? Okay. So hesitancy is delay in acceptance or refusal of vaccine despite availability of vaccine services and supporting evidence. So unless the patient is aware of the answer of the 5 WH questions and the vaccine is actually available, we cannot say that we have hesitancy at this point. So what are the reasons for hesitancy? From your clinical experience, what do you think the most common factors for hesitancy? Fears from side effect. What else? Misinformation. We see this a lot. Misinformation, especially through the spreading the information, incorrect information and rumors. What else? Yes, so fears related to the injection itself. Trust issues. I don't think that the vaccine is safe, for example, or effective. Or we have those extremists who believe in the conspiracy theory, but they are not too many. Their voices are loud, but they are not too many. And it's not if so negative past experience, we would say. Cost, we wouldn't really worry about it as it's covered, but yes, in general, yes, the cost could be a reason for hesitancy. So to summarize these reasons for hesitancy, concerns related either to side effect or vaccine safety or vaccine effectiveness. Also, it could be reasons or concerns related low risk of low perceived risk. I don't think that I am susceptible. I think that I am healthy. I don't think that I am susceptible or may get the disease. Distrust in healthcare organization or healthcare professionals. Autonomy and personal freedom concerns. This kind of concerns usually are combined with the mandating vaccines, not with optional vaccines. Lack of knowledge, and as they say back there, the incorrect information. So it could be lack of information or incorrect information may lead to hesitancy, negative past experience, and low perceived risk of the disease. Okay, so so now we know what is hesitancy and we know the common reasons for hesitancy. So how do we approach to the patient? How do we initiate the conversation related to herpes zoster vaccine? Can you imagine that I am a 53-year-old female coming to your clinic for a routine checkup? Can you write down in a piece of paper in front of you what is the first sentence? How would you approach? How would you initiate this conversation? Just the first sentence. How would you initiate the conversation? Keep it and compare it by the end of the session with the, and check if you would change it or you will keep it as it is. Just the first sentence. How would you initiate the conversation related to herpes zoster vaccine? So in order to respond effectively, in order to provide a counseling, we need to listen to their concern. Otherwise, if we don't understand what their feelings are, what their concerns are, we wouldn't be able to respond appropriately. So active listening is a key to acknowledge the core or the deepest reasons for our patient thinking and hesitance, the reasons behind hesitancy. So listen, then respond. Type, how do we respond, or how should we respond? For some healthcare providers, they look at the hesitancy as an adversarial experience, me versus them. So the conversation goes like a tennis ball, like table tennis ball, me versus them, trying to convince the patient. But by doing this, we are not building the relationship. We are not building the trust. But if we look at it as an opportunity, it's an opportunity instead of a challenge, opportunity to clarify, opportunity to understand the real concerns behind the patient, how our patients are thinking. It will change the way we react. It will change the way we interact with the patient. And if the patient feels that it is an opportunity where they have the chance to understand, also the patient will interact differently with us. When it is an opportunity, all of the sudden will become less defensive, less judgmental, and more empathetic. And of course, it will lead to a better outcome at the end. So the second strategy is to reframe the conversation. So look at the patient counseling as a challenge, look at it as an opportunity, not a challenge. Then ask open-ended question. We should encourage our patient to express their feelings by asking them questions that have more than a yes, no answers. This will give us a deep insight of how they're thinking and what their concerns are. So try to, I would say, minimize, not to avoid, minimize the yes, no question and more of an open-ended questions. Use a clear, simple language. Avoid medical jargon. Explain the complex content in an easy and simple way so the patient can understand it. Summarization. Periodically summarize to make sure that both of you on the same page. If there is any misunderstanding, you have the opportunity to fix it immediately during the conversation. And the last one today is for the patient education. Provide educational material for the patient to help informed decision by the patient. Sometimes if you don't have enough time to give all the information to your patient, handing over a complete and comprehensive educational material will help the patient to make an informed decision related to vaccine. So now we're going to discuss a couple of structures that will help us to develop or to create our message and our conversation to keep it memorable and complete. Because sometimes if we are giving and providing this conversation over and over, sometimes we miss some important information. So these structures will help us make sure that we are delivering a complete, persuasive, and keep it memorable for us. The first structure for today is what, so what, now what. So we are going to tell the patient what. In this topic, it will be the vaccine and the disease. We'll tell the patient about the vaccine and the disease. Then, so what? Why it's important for me. So for the what, we'll talk about the disease and the vaccine. Then, for so what, explain the why. Basically, so what, explaining the why. So by telling the patient about the herpes zoster disease and herpes zoster vaccine, then telling them why it's important for them to take it and what is the significance of it. Last thing, now what? Okay, so you told me what and so what, and now what is the action? What's next? The vaccine is available next room, or vaccine is available in the X clinic. You can take it by make an appointment through this. So you'll tell them, you will guide them through. You will tell them exactly how are they going to take this vaccine. The second structure for today will be the problem solution benefit structure. So you will start by the stating the problem. What is the problem in our situation for today? Is the problem is speaking in the conversation, I mean, of the herpes zoster disease. So the problem will be the herpes zoster disease or the Shingrix disease. This is the problem. Then the solution will be the availability of effective vaccine. So you state the problem, you mention the solution, the problem will be the burden of the disease, the solution, availability of the herpes zoster vaccine, and then the benefits, how it's beneficial for me. This vaccine will help prevent the disease and the possible complication that may come with it. So that's another structure that you may use to keep it, to make sure it's complete and it's memorable for us as a healthcare provider. The last structure we are going to discuss today is very interesting. It's called the DOSE approach. So what is the DOSE conversation? The DOSE stands for danger, opportunity, and solution. Why it's important, explaining, so what is danger, opportunity, and solution? So for danger, we are highlighting the danger. And then by opportunity, we are telling the patient what is the advantage or what is the privilege for them from this danger. How can they get a better quality of life from, how can they protect themselves from this danger? And last is the solution. What is the solution, which is in this situation is the availability of herpes zoster vaccine. Why this is important or why this is effective? Because the DOSE conversation touches on three fundamental emotions in the human nature. The danger triggers the fear, then the opportunity triggers the excitement, and solution will trigger the confidence. So by triggering these three fundamental emotions, we make sure that our patients, because we are, as a human, we are emotional. We are emotional creatures more than rational. So if we link our message with emotions, so here's the fear, excitement, and confidence. The danger bring up the fear. Fear of what? Fear of the disease, from the symptoms, loss, death, whatever they are afraid of. So can we just tell them about the danger and leave them كده afraid? After we provide the danger, we tell them the problem, then we're going to tell them, well, but the good thing is there is a very effective vaccine or a safe vaccine and you are eligible for it. So after triggering the fear, then we will trigger the excitement. What is excitement in this situation? The good news is there is an effective vaccine that can prevent from this disease and the possible complication. It triggers also the advantage, better quality of life, and the less discomfort. And the last emotions here is the confidence. Alas, after they get afraid, but then they got excited. Now they are confident that they can be protected from getting that vaccine. So we are walking them through these three emotions, ensuring that we link our conversation not only with information and fact, we link them with fundamental emotions. Let's put these strategies together in a role-play scenario where there will be an incorrect and correct responses, and we'll discuss thoroughly. It will be in Arabic, but the slides up there will be in English. أهلين أم تركي. متوفر حاليا لقاح للحزام الناري في المركز، وأتوقع أنك لازم تاخذينه لأنه مهم، وممكن تكونين في خطر الإصابة بالحزام الناري لو ما أخذتيه.
هلا والله دكتور.
Can you freeze? So what do you think of this approach? So the scenario, let's go back to the first. The scenario is a 56 years old patient, Turkey, comes for a routine checkup. Turkey is healthy and unaware of the disease. The patient is often busy and needs to get back to work. You would like to make sure she got vaccinated. So what do you think of the healthcare provider approach in this situation? Can you say it again, Leila? The same one? أهلين أم تركي. متوفر حاليا لقاح الحزام الناري في المركز، وأتوقع أنك لازم تاخذينه لأنه مهم، وممكن لا قدر الله يجيك الحزام الناري لو ما أخذتيه. No report, no danger. Immediately, just throwing up information. I'm glad you came in today for your checkup. There is a Shingrix vaccine now, and I think you should take it. Where's the autonomy of the patient? Where's the danger? Where's the information? Right? Do you think that the patient will respond to this approach? Of course not. Will not take it seriously, probably, or she will not trust you. خلاص. Because we did not build the relationship. The first thing, we should build the relationship and build the trust with the patient so we can continue the conversation. طب how can we make it better? أهلين أم تركي، يسعدني مجيئك اليوم لأني بصراحة حابة أتكلم معك عن مرض يصيب بالعادة البالغين الأصحاء، ووزارة الصحة ماخذ الموضوع طبعا بجدية ولأنه شيء ممكن الوقاية منه.
أهلا دكتورة. هلا والله. اللقاح ثاني بصراحة أحس إني أنا ما أحتاج. بصراحة ما أحس إني أحتاج لقاح. الحمد لله صحتي جيدة، ويعني أمارس رياضة وأكلي صحي. ما أحس إني أحتاج لقاح، وأنا سمعت كلام كثير عن اللقاحات على مضاعفاتها وأعراضها الجانبية. فيعطيك العافية دكتورة، ما راح أخذ اللقاح.
What do you think of this response? Correct, صح? Started with greeting the patient, giving them a highlight. Just, there is something that I would like to talk to you about, something serious. So grabbing their attention, and the response was said here is the response to the previous, that there is a vaccine that you should, and I think you should take it today. So here, there is a trigger, there is an information, there is a serious disease that I would like to talk to you about. There is kind of, the healthcare provider, he is trying to build the relationship with the patient. How would you respond? So the patient said, another vaccine, I doubt I need it, I'm healthy and I have an active lifestyle. Besides, I've heard so many negative things about vaccines. Let's check the first response. الهيلث وركر. والله شوفي الكلام فاضي ولا تتأثرين بالشائعات، يعني اللقاح آمن نسبيا وتقريبا ما له آثار جانبية، فأنا أنصحك إنك تاخذين اللقاح. What do you think of this response? كلام فاضي مستفز كثير. Very. So don't be influenced by baseless rumors. So if you are telling me this, you are basically indirectly telling me that I'm dumb. How am I believing in this kind of things? Am I going to trust you, or am I going to respond? There will be even more resistance. Sometimes the patient will try even to defend, and the resistance will increase. The vaccine is relatively safe. There is little to no side effect. Is this true? No side effect? So disrespectful, come on, inaccurate information. Trust me, you should take it. Why would I trust you? So what do you suggest a better response? يلا, say it. Say it.
More about the complication. Do you want? Okay, I repeat.
So عادي, you can say it in Arabic. How would you respond exactly?
Okay.
تطعيم ثاني ما أبغى آخذ ولا
Okay.
سمعت عنه أشياء. How would you respond?
أول شيء قرارك يعني أحترمه definitely. But how about I talk more about the disease? Do you know about Schengen? تعرفين عن الحزام الناري؟ شو الأعراض المصاحبة حق الحزام الناري؟ شو رأيك نتكلم أكثر عنه؟ تعرفين أو خلينا نتكلم مثلا خلينا أبدأ أنا how about I give you the example? Okay. I will start the conversation with السلام عليكم تركي. How are you today? شلونك؟ عساك بخير. تركي أنا ذكريني صادك مثلا التشيكن بوكس يوم كنت صغيرة؟ She will say yes or no. If she said, for example, yes, because the majority is yes.
Correct.
تدرين تركي إن الحزام إن الفاميلي حق التشيكن بوكس يكون موجود في جسم الإنسان طول الفترة يتنشط مع العمر اللي فوق 50 سنة. And if she said مثلا I will have to listen to her at the beginning.
Of course.
And then I will tell her تدرين أن الحزام الناري الأعراض المصاحبة له غير أنه طفح جلدي أن الآلام المصاحبة له أكثر من آلام الولادة.
So can you stop here? So here she's highlighting what of the dose approach. So she's talking about the side effect, right? The symptoms of the disease.
The danger.
So here from the dose, what she's triggering in this sentence?
Danger.
The danger. She's triggering the danger. Okay. So is it enough just to
No.
talk about the danger?
No.
Okay.
And
Continue.
then I will tell her, do you know, and there is availability of the vaccine and it's free from charge. And the Ministry of Health is instructing us to give you this vaccine just to protect you. And
Can you stop here? From the dose, what is it? Is it danger, opportunity, or solution? There is effective vaccine that is available and you can take it. Is this danger,
Opportunity.
opportunity, or solution? It is a solution. So there is a vaccine, effective vaccine available and you can take it. This is the solution. You are eligible to take it because you are above 50. You don't have any previous vaccine allergies. So by stating or by telling her that she is eligible for the vaccine, here we are triggering the opportunity. Telling her about the vaccine is the solution. Thank you. Continue.
later on عقب ما أقول لها إن there is available vaccine أقول لها there is some side effect. The side effects is mainly يعني in some people and some people is not feeling it, but we can overcome it by taking the paracetamol just in case. And the vaccine is in 2 doses. You can.
MashaAllah, you mentioned all the scenario. You're super, you're mastering it. MashaAllah, I would clap. Thank you. What's your name? عفوا.
رائلة.
يعطيك
الله
العافية
يعافيك.
دكتورة علا. شكرا. طيب let's go back to our scenario. So we agree that this one is incorrect. Don't be influenced by baseless rumors and this vaccine relatively safe. So let's have the other response. Layla.
طبيعي وتركي إنه يكون عندك بعض المخاوف وأنا أتفهم، لكن هل تعرفين إنه 1 من كل 3 أشخاص عمرهم فوق 50 يصاب بالحزام الناري؟ والحزام الناري احنا نتكلم على طفح جلدي مؤلم جدا. طبعا اغلب الناس يوصفون الالم تبعه انه زي الم الحرق، زي الم الصدمه، الم جدا صعب، وممكن تكون له مضاعفات خطيره يعني مثل الم الاعصاب اللي ممكن يستمر لاشهر برضه.
So, what do you think of this response? It is understandable to have concerns. What is this? Empathy, right? But did you know that 1 in 3 people over 50 get Shingrix? Danger. It's painful, blistering rash, and many describe the pain as burning, stabbing, or shock-like. Come on, danger. طيب. There can be serious complications like nerve pain that last for months. Again, repeating the danger. But it is danger, but we didn't stop the conversation here. We cannot keep talking about the danger for the whole conversation. But this is just a one sentence and we will continue. But for this sentence, it is empathetic. I understand your concern. So showing empathy to our patient and then give a factual information related to the disease and its signs and symptoms and the possible complications. طيب.
شكرا دكتورة، بس شكل يعني المرض فعلا خطير، بس صراحة أنا دائما محافظة على صحتي وأحس إني ما أحتاج اللقاح، وأحس لو أخذت اللقاح راح يأثر علي بشكل سلبي.
That sounds horrible, but I keep very healthy. I doubt this would affect me. We hear it a lot. So let's hear the first response.
أعرف إنك بصحة جيدة وأعرف إن أنت شايفة نفسك كويسة، بس هذا مرض خطير ويصيب الأشخاص فوق سن 50.
I know you're healthy now, and you think you're fine. Why? What was wrong in this sentence? Very judgmental. You think you're fine. You're healthy now. You think you're fine. Very judgmental, dismissive to the patient. يعني it's not true. طيب, this is a serious disease. It affects people over. It's lack of empathy. What else in this sentence? What went wrong in this sentence? So we agree that this is incorrect, صح? This is wrong. استصغار, صح? Dismissive, very dismissive and judgmental. طيب, tell us, دكتورة ليلى, how can you make this better?
هو الحمد لله طبعا ان انت بصحه كويسه، وهذا الشيء اللي يخليك صعب تتصورين المرض او الالم تبعه. لكن انا شخصيا شفت كيف انه الحزام الناري ممكن يخلي ابسط الانشطه اليوميه تكاد تكون صعبه، الجلسه مع احفادك، اللعب معاهم، الانشطه اليوميه كلها تكون جدا صعبه. لكن الخبر الكويس انه الحمد لله تقدرين تحمين نفسك وتتجنبين كل هذا الالم والمضاعفات. الوزاره طبعا توصي باخذ اللقاح. اللقاح عباره عن جرعتين، تاخذين الجرعه الاولى الان باذن الله، والثانيه خلال 2 إلى 6 شهور. وطبعا ضروري تاخذين الجرعتين عشان تاخذين الحمايه الكامله من المرض ومضاعفاته باذن الله.
What do you think of this response? Let's go through it. You are healthy, so I am acknowledging the patient, what they have said, and that's what makes it hard to imagine. Again, there is emotions here, make it hard to imagine. But we've seen how Shingrix can make even the simplest daily task impossible, like playing with your grandchildren or walking outside due to pain. So we are stating the danger with something that relates to the patient's personal concerns. Imagine you can't, because she's saying that she's healthy, and by acknowledging that she is healthy and relating the danger to a real life situation that will relate to the patient. So stating the danger, then the good news is you can protect yourself and avoid the pain and its complications. What is this from the dose? Opportunity. The Ministry of Health recommends this vaccine, and it's only 2 shots. one today and the second in 2 to 6 months. Both doses are needed to give you full protection. So here we are mentioning the opportunity and solution. After mentioning the danger, then we are going to mention the opportunity and solutions. Let's see our patient if she's convinced ولا لا. Najud will give us hard time شوية today.
طيب دكتورة، هل في أي أعراض جانبية؟
Are there any side effects? Let's check their first response.
لا تقلقين من ناحية الآثار الجانبية، يعني موضوعها بسيط. اللقاح آمن.
What do you think? Why not? There is side effect because this is incorrect information, and by delivering incorrect information, we are losing the trust and breaking the relationship we're trying to build since the beginning of the conversation. Side effects are rare. This is incorrect. You shouldn't worry about them. Again, dismissive. All the orange chats are dismissive. Do you have another response for us, Leila?
Sure.
Let's check it out.
هو شوفي، أكيد في بعض الآثار الجانبية المحتملة، مثل نتكلم على احمرار، ألم مكان الحقن، ممكن تحسي بشوية تعب يوم يومين، ممكن صداع شوية، لكن كل هذه الأعراض عادة تكون خفيفة وبإذن الله بسرعة راح تختفي. وبرضو أكيد إحنا حنتابع معك نتأكد إنك بصحة كويسة إن شاء الله بعد ما تاخذين اللقاح. لكن أنت برضو لازم تعرفين إن المضاعفات اللي ممكن تجيك من الإصابة نفسه بالحزام الناري، ولا قدر الله المضاعفات تبعه اللي هي ألم الأعصاب أشد بكثير. فوينكم يعني لما تقارنيها بالألم اللقاح نفسه أو الأعراض الجانبية هي ولا شيء بإذن الله.
What do you think? There are few possible side effects, so we are telling facts. We are telling the patient that there is possible side effects. So we told the patient about the danger, the possible danger, which is the mild side effect. But again, we talked about the solutions and opportunity. Here is solution. We talked about the solution that, excuse me, it's another danger that these mild side effects are way less than the severe pain that you might experience from getting the disease. So by giving this statement, we are not dismissing the patient concern. We are giving factual information related to side effect. We are telling them that we are going to monitor you. So there is a solution. If you are worried about the side effect, we are going to monitor you immediately after you receive the vaccine. So the patient is kind of reassured. If I am worried about this, I am reassured there is someone going to monitor me and watch me, and then emphasize that the pain that comes with the disease is way more than the mild side effect comes with the vaccine.
أوكي.
يلا.
الله يعطيك العافية دكتورة، بصراحة أنا اليوم مرة مستعجلة وما أتوقع أن عندي وقت أخذ التطعيم. يمكن وقت ثاني إن شاء الله.
You see, Najud is giving us hard time again. So she's saying, I don't know if I have the time right now. So here the patient concern is the time. So we can still push a little bit. But what if the patient here said, I need time to think? Probably we should stop there because we don't want to be she. But in this situation, the patient said, the concern is the time. It's time issue. So it's a problem that we can find a solution to. I don't know if I have the time to get it right now. Leila?
خلاص تمام، فكري في الموضوع ونناقش إن شاء الله في زيارتك الجاية.
خلاص بكيفك.
شو بتعمل؟
طفشتيني.
ماما كانت عم تظبط شغلي بالحمام. ماما كانت عم تعمل تظبط شغلي بالحمام هنيك.
مع
شو
السلامة.
تظبط؟ البريج.
So by doing this, probably we are showing the because throughout the conversation we're trying to tell the patient how urgent it is. But by doing this, we are reducing the urgency of the vaccine. Can we make it better? Or khalas, you're tired of Nujud and you want to stop there? Because we can make it better because the concern here is time. It's not it's not that يعني, she doesn't have the time. It's not that she wants time to think or she's not convinced. The concern here is the time. So do you have a better answer يا ليلى؟
Sure.
طيب
أعرف إنك مشغولة الحين أم تركي، والكويس إنه ممكن نعطيك الجرعة الأولى الآن حالا في الفاكسينيشن روم هنا جنبنا، وتقدرين تكملين يومك طبيعي بإذن الله، وبرضه راح نرسل لك ريمايندر على كتذكير للجرعة الثانية بإذن الله.
ما شاء الله. The second version of Layla is super. So now Layla is saying, I know you're very busy, Turkey, but the good news is we can give you the vaccine right now, the next room. So we are giving a solution to the specific concern that the patient has right now. It won't take long and you can go back to your day. Plus, we will send you a reminder for your second dose. Probably at this point, our patient is convinced already. But this is not the situation for Najud.
بصراحة دكتورة أنا أحس إني لسه مو متأكدة. خليني أفكر شوي بالموضوع وإن شاء الله يمكن المرة الجاية.
So usually in the previous slide, some of patients are convinced already. But let's say we have a difficult patient like Najud and they are taking a very long time. They want to make informed decision, I would say. We need to keep the door open. We want them to come back to us. How can we respond to this? Because our patient is still not convinced and we don't want to push further. Because now the patients want time to think. It's not time, the patient needs time to think of taking the vaccine. So how can we respond to her with respecting her autonomy and keeping the relationship we created throughout the conversation, making sure that the door is open, and whenever they have a concern, they will come back to us. So you want to try to convince. Well, that's awesome.
Push harder, yeah. I may not push harder because she may lose trust in that we are pushing too hard on her.
Yes.
But we will.
So
we will
probably telling this in the earlier stage before the thinking part. But yes, informing the patient that so many have received the vaccine is one of the approaches that we can use to reassure the patient related to vaccine safety and effectiveness. So what would you say, Layla?
أتفهم كلامك صراحة، وأنا سعيدة أن أنت حتفكري في الموضوع، ومن المهم طبعا أن أنت تاخذي قرار مبني على معلومات صحيحة. فحتى أنا ممكن أعطيك هذا الكتيب تقرين فيه أكثر عن الديزيز، عن المرض نفسه وعن اللقاح. وطبعا أكيد لو لسه عندك أي استفسار، لو عندك أي سؤال، أنا موجودة على طول راح أجاوب على أسئلتك. يعني تقدرين تتواصلين معنا في أي وقت أو حتى تجيني المركز. خذي وقتك بالتفكير ولا تترددين في التواصل معنا لو احتجتي أي شيء.
خذي وقتك في التفكير ولا تترددي تتواصلي معنا. Take your time thinking and don't hesitate to contact us anytime. I am available anytime. Take this educational material and read through. I understand that you want to think. All of these will increase. First, we'll keep the relationship. We'll keep the door open for the patient. The patient will not feel the pressure and they will want to come back once they make up their mind. So we just want to make sure at the end that we keep the door open and we don't push further. Thank you, Layla and Najud. I hope this was... Here is a summary of the do's and don'ts in patient counseling. Build trust in rapport, provide accurate information, listen actively, encourage informed decision making, respect patient autonomy. For the don't dismiss concerns, don't overload with information, don't be judgmental, don't pressure the patient, don't ignore emotional responses, don't use the MOH memo as the main message, and don't mention Shingrix that a rare disease. I would like to conclude with a very interesting study conducted here in Saudi Arabia related to increasing the accessibility of vaccination against herpes zoster. The acceptance of herpes zoster among participants was 25% at the beginning of the study. Later on, the number was tripled after the healthcare provider recommendation. So we as a healthcare provider, and I think Dr. Wayne mentioned a study like this conducted in Australia. So we have a role in increasing awareness related to vaccine and vaccine-related topics. I hope this session was helpful to integrate the effective communication strategies and use it to provide effective counseling. Now, last thing, there is a barcode. If you want, can you scan this barcode? There is a very interesting tool developed by JSK. It's a simulation of a real-life scenario where you will have the chance to counsel a patient. Our audience from the online, there is a link in the chat box that you can click and access the Ching Chat, they call it, صح? Ching Chat. It's a very interesting tool developed by JSK. When you open it, there is a blue arrow that you can click on. Then it will ask you to put your name, just type your name, and it will walk you through the counseling process. فتح معانا؟ في أحد ما فتح معاه اللينك؟ إذا في أي أحد عنده issue أو حاجة. Once you scan the link, there is a blue arrow كده في زي السهم الأزرق to start the conversation. أيوة في الchat the first question will be what's your name? You'll type your name بعدين it will start. Yes, I already told the audience online. Yeah. So for the audience online, I'll say that again. For the audience online, the link is in the chat box. You can link it and get to the page. This is a great opportunity to practice. Thank you. So I would like to thank you for your time and attention.
Thank you, Mr. Sulafa, for your nice presentation. And I think it was very attractive way to explain how we could overcome this challenge really in hesitancy among our patients. So I believe really the most person who the patient can trust is the healthcare practitioner. But as Ms. Sulafa said, for healthcare practitioner, they should build rapport between them and the patient. A good communication is important for the patient to trust his healthcare practitioner. So I hope as we lecture very beneficial for you. We learn all from the way that explained by Ms. Sulafa. So after we finish this Shing chat, I think now it is the time to the chair. Can we gather the chair? So now I will call Dr. Wayne and Dr. Riyada and Ms. Sulafa to come to the stage. Just we will have the Q&A session. We will start with our guest here. We will hear from their question, and then inshallah we will take the question that we received online. So I think now we can start with the question from our audience here. So who have any question, just raise his hand, and then we will make the chance for him to ask his question. So we have one here. So you can ask your question now, please.
Yes, excuse me. I'm directing the questions to the chairpersons, and it's about if patient have had serology positive for the vaccine. I think this would be a chance for him to take the vaccine. But if he had serology negative and he don't have the latent virus inside him, why shouldn't we check the serology first before giving him such a vaccine?
Did you get the question? Okay, let me repeat the question. Please correct me if, in case we didn't get right. The person is asking, would it be justified to obtain serology prior to getting the vaccine? Had the patient been serology positive for varicella zoster, then they would qualify better for the vaccine. If they are serology negative, they may not qualify. صح?
Yes.
That's what he said.
Yeah, very good question. Over 90 to 99% of patients who are 50 years of age and older are already positive for the blood chickenpox. So doing the blood test is, from a public health point of view, is not necessary. It's a really increased cost. So I'm a perfect example of that. I've never recall ever having chickenpox. When I was a resident, I thought I'd go and do my serology, and lo and behold, was positive. So I identify that very nicely. So you do not need to routinely do that.
Although we take the childhood vaccination for chickenpox, why it's coming? Although we take the chickenpox vaccination, why nowadays we take the chickenpox vaccination for that virus? Why it's coming at late age, or is that percentage high percentage?
Oh, yeah. I believe, you're saying we're taking chickenpox already, right? So why are we doing that again? Because the immunity would wane. Like I have.
Should we have a booster
to
cover these kind of?
Well, what is studied is for the Shingrix vaccine is that you give one and then you boost it thereafter. There are no studies that I know of that you boost the life attenuated vaccine. If I were to add to what Wayne mentioned earlier in the response to your question, to add and say the fact that serology negative does not necessarily rule out the past history of exposure to the virus. So even if you got it negative, it does not mean or doesn't rule out the fact that the patient was exposed. And another important message in the same context is regardless of patient history of varicella zoster in the past or not, Shingrix vaccine is indicated. So the patient had it or did not have it, they're still indicated to get Shingrix vaccine.
Thank you.
Thank you.
Okay, we have other question, please. Yeah,
right here.
Sure.
when I have patient is positive with shingle vaccine, with shingle virus, when is the time to revaccinate the patient since it's high rate to reinfected again?
Yep. So the question again is, person has shingles,
Yes.
when should I get the vaccine? Okay, so number one, they're the most likely person who wants to be vaccinated. They don't want to get it again, right? The pain is significant. And so they're really motivated to be vaccinated. Can I be vaccinated as soon as possible? Well, the answer is yes, you can do it soon. The national recommendations here and in elsewhere state, oh, we wait a year. Well, why do you wait a year? It's not based on evidence. It's rather based on eminence. Eminence meaning some specialist sat on a table like this and decided to make a decision. So that's how the 1 year came about. So what's happened is in the United States, in Europe, and in Quebec, they've made it 8 weeks.
8 weeks.
8 weeks after. So
Regardless of the symptoms, even though he's having still the rash, we're gonna give him the vaccine.
So if he's had the eruption, and as soon as the eruption settles, and that's generally what I tell people, once the eruption is settled, within 8 weeks, yes, you can receive the vaccination. And those people are very motivated at being vaccinated. And so because they're so motivated, you're not going to lose them. If you say, come back in a year, you're going to then say, they're going to forget about it.
Yeah, and then the other important thing, sitting next to Salaf here, when Wayne said they are coming to you with pain, right? So you got to take the opportunity, stressing the danger, right? So you tell them you want to get that again, or you want to stay for that for a longer time. I think Salaf, is that what you want to say?
And I wanted to just making sure I understand Dr. Wayne's response. So you're saying 8 weeks.
8 weeks after.
So you said 8 weeks after the resolving of the symptoms,
Yes, that's.
or 8 weeks for the total, regardless of the symptoms, or is it 8 weeks after the symptoms has been resolved?
That's a good question. Do I wait 8 weeks until after the rash is gone, 8 weeks till after the symptoms are gone, or 8 weeks from the beginning of their symptoms? It really is probably, it's your decision, and it's really unclear what they mean. But generally is once their symptoms have settled, yes, they may have post-herpetic neuralgia in some people, but once their, ophthalmologic symptoms, their face is settled, all the rash is gone, then yes, you can vaccinate them. So we're talking about 8 weeks, and it's not a hard and fast number. It's really your personal discussion with the patient. And so say, when would you like to have it? Are you ready next week, next month, a month later? So it's really a discussion you can have with the patient. So it's not a hard and fast number. Yeah.
Okay. Go ahead.
Assalamu alaikum. I just have a question regarding the last presentation about how to address the
microphone close to you? We cannot hear you. Yeah, we cannot hear you.
Okay, now?
Yeah, please.
Okay, I have a question about the approach to the patient. The last now presentation.
So this is for Dr. Sulafa.
Dr. Sulafa, welcome, Doctor. My question is, wouldn't it be better or good to start with assessing the patient knowledge first? Like now, I'm talking from a practical point of view. We saw this many times. Now, this age group of 50, most of them are patients, yes, but some of them sometimes come just in the BHCs and we found them in other places. But the point is, many of them now are knowledgeable already. They have already background. Yeah, they have their beliefs, either agree or disagree. Okay. And we saw how to address everything. But the starting point, yani, I think this approach now, yes, it is good. Like I am X, I want to talk to you about, or I'm going to present you this vaccine. But from other point, wouldn't it be better if we like starting by asking the patient, what do you know about Shingrix? What do you know about herpes zoster? What do you know about herpes zoster vaccine? Like in this order. Then according to our assessment to the patient, level of knowledge and perception, it will be like a good starting point. From there, we can start by agreeing with what correct about his beliefs. Then we go to the next point. In this way, I think we get more trust and confident relation with the patient. Instead of like we come at presenting something, he already have some information about, we consider him like he has no background. Then we become like, yani the point is, I don't want as a promoter to the vaccine to be defensive, to be in the defensive position. So
I
this
think
is
it
my
is clear.
question.
Clear, thank you. Yeah, Dr. Asma.
Thank you for your question. So when it comes to counseling, especially if it's not correct, there is no right and wrong. It depends on the situation. But I would say, and we may have it open for discussion. I would say provide the information, because if you assess the patient knowledge, probably you will come across two unwanted situations. The first one is probably the patient has an incorrect information, incorrect, I would say, incorrect information, and by letting the patient saying or repeating the incorrect information, it will stick more to their mind. And that's something that we don't want. The second situation that may come through, the patient might feel discomfort. Let me give you an example that we have may come, and I heard this example I heard this conversation before. So imagine if I come to you, so who didn't hear about the stock market here? Who doesn't know about Al-Asham, for example? We know about stock market as a stock market, but do we know details? Probably not. If a banker or someone who's expert come to us and ask us, do you know about the stock market? Probably I would say, yes, I know, but I don't know. So what do you know about stock market? Probably I'll be a little bit discomfort because yes, I know the highlight, like I know the topic, but I don't know details. So probably I'll start by saying whatever. I will just fill up the gaps. I'll keep saying information that I heard from here and there and try to put it in one sentence to make it make sense for you. But starting the conversation that I would like, if you want to start with, do you know about the herpes zoster? If the patient said yes, I wouldn't wait for the patient to tell me what they know about the herpes zoster. I would probably encourage them. I will emphasize, that's great. You know that you are from the 30 or 40% of people who are aware of the herpes zoster. I will make them feel good. So they will, by doing this, I'm gaining or building a relationship and building a trust. But I wouldn't wait for them to tell me what they know. I will just start by telling them the most important facts related to the disease and the vaccine, especially that it's not too much. It's probably 3 sentences. You know that 1 out of 3 who got the chicken pox might get this. So it's not more than 3 sentences. Probably the patient trying to remember it will take longer than you just start by saying what you want to say.
Thank you, Sulaf. I will take some question from the online here I have. We received one question here. This is for you, Dr. Ween. How about if a patient or the recipient receive the first dose and he's supposed to take the second dose after 2 or 6 months? How about if he forget to take the second dose after 6 months? Shall I repeat the first dose or I can give him the second dose regardless the duration between the first and second dose?
Yes, that's a very common question. So repeat it again. They get the first dose and time has passed and they've forgotten. It's been a year or more or even longer. Do I need to start all over? The answer is no. You simply pick up where you left off. So that is a very good question. And again, reiterate that this is true with all multi-dose vaccines. For example, the combination hepatitis A and B vaccine, the HPV vaccine, you just simply pick up where you left off.
Thank you for this short answer. I have a question. This is from my side, not even from online, from physical. We have nowadays in our country here, we start RSV vaccine for adults who are above 60. And you know RSV vaccine is adjuvant vaccine. Again, we are giving RSV and herpes zoster for the same age group. So if I have one of our beneficiary, he came to me, is asking me, please, I don't like to come back again. Can you give me RSV and herpes zoster at the same time? Because you know both of them are adjuvant vaccine. So what is your opinion, Dr. Wien?
That's a very good point. The issue is I'm going to get a sore left arm and I'm going to get a sore right arm. And so when should I be doing this? So should I be doing this on Thursday or Friday when they have some time off? Really, I think if you advise patients, there's going to be some discomfort, but it is manageable. You know, some physicians say, well, maybe we should separate it. But if time is a constraint, and if the person is, you know, using the Julius Caesar from Latin stating carpe diem, seize the day, you seize that moment. And if they're there and available to you, yes, give both of them.
Thank you. Thank you. This question for Dr. Tariq. What is the most effective analgesic for herpes zoster pain?
The most effective analgesic?
Yeah.
Well, most of analgesics would work. What has been tried by most of us, it's not based on studies, it's based on our observations and response of patients, is paracetamol. Simple, easy, inexpensive, over the counter, minimal side effects, and then patient has experience with it. Yani, you would hardly ask somebody to take paracetamol who would say, I've never tried paracetamol before. So in most part, it does. Sometimes NSAID may be required to some when they really have, you know, severe symptoms. But in general, I personally haven't advised anything beyond paracetamol that I have seen it's not working. Some patients, they have tried other things by themselves that we did not advise, but they continue to complain of the symptoms despite whatever else they have tried, because they have a negative impact toward that anyway. So it may be psychologically they're feeling negatively toward the vaccine, you know, and then they've been saying it was a horrible fatigue. One patient was describing chills and sweats, you know, at night. And he was saying this is worse than anything else and what have you. Once that symptoms, you know, disappeared, they're back to their rationale and logic, saying, no, I think I did good by taking the vaccine. So the fact when they sometimes express their side effects of the vaccine momentarily at the time of the intensity of the symptom, it does not necessarily reflect what their own belief subsequently about their experience.
Yeah. This is, I think it is very interesting question, really, because most of our patients, they are hesitant to take the vaccine because they link the vaccine and the most of immunological disease that happened after vaccination. So what is your opinion, Dr. Tariq and Dr. Wien? Is there any relation?
Well, my opinion is what the studies said. If there is no association found from these trials, then the answer is no. There is no harm from this vaccine as far as that is concerned. It is very interesting to see data for Dr. Wayne that we went beyond, you know, the regular 4 years and we're up to 9 years now. And then it gives fairly good comfort to state that there is no long-term sequelae from this vaccine. I don't know.
You have any comment, Dr. Wayne?
Yes. So that if I understand the question, they are still concerned about side effects?
Yeah, I mean, they relate some of the immunological disease to the vaccination.
Yes, okay. So, very good point. We are now studying this. We're going to take it up to 15 years. We're now at 12 years of data. The 12-year data will come out, but we have 11 years already. In 11 years, there's been no evidence of things like Guillain-Barré syndrome, immunological causes of diseases due to vaccination. So with this vaccine, there's been no evidence of some prolonged or delayed problems.
So thank you. I don't know if you have an answer for this question, Dr. Tariq. One of our audience here, he's asking, we have one patient who he's not diabetic, but he's having a biologic treatment for eosinophilic bronchial asthma, Dabilumab. So, is there any contraindication to give the vaccine since he's having this medication?
I can't say why not that can be given. There is no specific contraindication. I may not know the answer specifically, but I don't see any reason, why the vaccine not to be given, because there has been no particular contraindication. You can correct me, Wayne, if I'm mistaken. And the other thing is, asthma alone is an indication for possible Shingrix, so Shingrix vaccine. So the patient by the broad line qualifies for the vaccine, and I don't see the medication taken by the patient would contradict taking it.
Thank you. So if you have any question from the audience here, please. Okay, after I have one comment from there, Dr. Khalid, then we'll come to you, Dr. Khalid.
It's about the mounting of the immune response. Mounting of the immune response with these kind of biologics. For example, patient on IBD and he's taking biologics or taking immune suppression, and then we want to decide about biologics, he's immune suppressed. And if it is going to mount a good immune response with this kind of immune suppression, with these kind of patients, for example, patient on steroid for suppressing an acute ulcerative colitis, for example. And is there any kind of other scenarios where we should be fearing of not mounting a good immune response that we should take care of?
Yeah, I mean, thank you for the question. Yes, we've learned from experience with COVID, for example, that CLL patients may not mount, the appropriate response, but that we wouldn't stop giving them just because they wouldn't mount. If they don't mount the response, okay, it was having a placebo effect. But yes, you will be concerned that you are giving them and then not getting the right immunity. If you get a window that you can, for whichever reason, the medication is stopped, and then through that window the vaccine can be given, it would be better. But if that is many times not possible, then I would give the vaccine and hope for the best. I don't know what you would say, Wayne.
That's a very good question. So your question is essentially, someone's immunosuppressed. Their response to the vaccine is going to be decreased somewhat. So there's degrees of immunosuppression. We saw people with diabetes still had a very good response. But what about individuals who are in biologic therapies? We do note they have a somewhat decreased response. What about people who have chemotherapy? They too, bone marrow transplant. So far, this is the data, so far, there's no need to revaccinate, but we are looking at that group, and there will be a decision down the road whether they need a third dose or whatever. But so far, no need to give them a booster or third dose.
Perhaps, one last point, doctor, in the same regard. Data for the vaccine indicate that you could somehow prepone the second dose after a month if the patient are to be subjected for bone marrow transplantations, or they're going to be subjected to high doses chemotherapy as ablative therapy or something of that sort. So you somehow could adjust to give them their second booster a month instead of 2 months, just in a way to facilitate for them. So
to shorten the duration. Instead of 2, it will be 1 month.
Exactly.
Thank you, doctors. We have a comment from Dr. Khalid, please.
Just maybe to mostly answer it actually. We have seen patients in immunomodulators like psoriatic patient, rheumatoid arthritis patient, or psoriatic arthritis patient. From the literature review, actually, we do, and they are already on treatment. It's not just to start, okay? But according to the literature review, that we can give it in order to get a better response to come at the end, you know, just before, like, for example, 2 or 3 days before his next dose, let's say, like, if the patient had Humira or whatever, and it will be a good time at that time to give him the vaccine. And then you also arrange for the other vaccine or the second dose.
Yeah.
And it would be better, as Dr. Musso said, it will be like if you want to facilitate the things and that, you give it after 1 month. But, sorry. Sorry? Yes. But the other things, you know, I'm just interested. I don't know, is it the adjuvant to do with these things, you know? We have noticed actually that the side effects, when you give it, the earlier is the second dose, is less than that when you do it, like comparing, for example, 0 to 1 to 2 or 0 to 6 or 0 to 12. We have seen it, you know, once, for example, you are delaying the second dose more, then we can see the second dose side effects appearing more prominent, especially the fatigue, as I was discussing with Dr. Musso before. I don't know, is it something to do with the adjuvant itself, or this is probably...
If I may repeat the question, because we've discussed it and I know exactly what you're referring, we would like to see your take about this, Wayne. Dr. Khalid is stating, from his experience, he have noticed when the second dose is being delayed up to, for example, 12 months compared to 2 or 3 or 4 or 5 or 6, that the side effects are more propagated at the time. So is that something you have observed?
Very interesting. That's interesting comment. I've not seen any data that states, oh, if they had a severe bad response at first, let's wait for 12 months for the second. I've not seen any data to suggest that is the case.
I mean, I'm saying that the more you delay...
Increased, so it's increased. Yeah. So your point is, I think that the second dose is just as, you know, somebody has a bad response to the first, you know, the second is not going to be muted. It'll probably be about the same. Yeah. I think this is all very important. It comes down to, we discuss this with the patient. Yes, talk about potential side effects. And I tell them, you're going to get it. Do expect it. But the benefits do outweigh the risks. The 3 days or so of discomfort far outweighs you having to be worried about it and getting the disease. And I can tell you almost from personal experience, if you have shingles, it is not something nice to have.
So thank you. By this, we'll end our meeting today with my special thank really for our distinguished speaker, Dr. Wayne, Dr. Tariq, and Dr. Sulafa. It was an interesting discussion. It was interesting lectures presented by them. I hope at the end of this, we'll go back to our home, to our offices with a good knowledge about the herpes zoster vaccine. So we can recommend this vaccine to our patient, to our beneficiary, and we know how to overcome the hesitancy by what we learn, by the way that we see from Dr. Sulafa. By the way, we have the herpes zoster vaccine. It is available in all of our BHC in the Eastern Health Cluster. We are welcoming all. If you are in private and you find anyone who is above 50, the vaccine is not available if your facility, just recommend him to go to the BHC. He will receive the vaccine, inshallah. He can book appointment through Sahiti application. Most of our colleagues in the BHC, they are welcoming those patients to give them this vaccine. So thank you for you also, our audience. Thank you for our audience online. And I just want all of you or some of you who are willing to come to the front to have a photo, a picture with our distinguished speaker. And I will not forget to thank GSK for their extraordinary really in efforts, not only for this event. I used to work with them really. They have a good work to increase the knowledge, to increase the awareness of the vaccination, the importance, not only for the community, but also for our healthcare practitioner. So thank you all, and you are welcome to come in front to have this picture.
Thank you.
Just to announce, the lunch, inshallah, it will be after this, after the picture, we'll go to the main hall next to this hall, okay?